On a brisk January evening, more than 2,000 Cook County residents overflowed the basement of the Markham Courthouse for a meeting with the Cook County Board of Commissioners. Hundreds were turned away, unable to vent their frustration with this year's county budget cuts. Last fall, Cook County Board President Todd Stroger promised in his campaign not to raise taxes to cover the $500 million budget shortfall. In January, President Stroger proposed some dramatic cuts to accomplish that feat. As many as 16 of the county's 26 health clinics would have to close. For many residents of Cook County, the closures would reduce their already limited access to quality health care. For county employees, the closings could lead to unemployment, since the budget suggested cutting more than 1,000 workers from the health system. According to Stroger, the cuts were needed so that county resources can be reserved for the most essential services.
And I indicated that from inaugurational day forward, there are no more sacred cows in Cook County government. Today, we introduce the county government an improved culture of accountability. We do this by living within our means, attacking government's bloat wherever we find it.
To Stroger, one of the biggest sacred cows was the county's healthcare system, with its clinics that sometimes sit empty waiting for patients. Under the new budget, more than 1,100 health department employees will lose their jobs, including about 200 nurses and 85 doctors. The county has not made a final decision on the clinics, but currently 9 clinics are scheduled to shut down. Some health experts worry about the long-term implications of the reduced budget. Dr. Jack Sponziger is the director of the School of Public Health at the University of Illinois Chicago. His research focuses on the cost of health care related to chronic illnesses such as heart disease, cancer, and diabetes. He has found that nearly 75% of all healthcare expenses come from treatment for chronic disease. The budget cuts could cause problems for Cook County because they reduce money spent on prevention and care for chronic illness. Commissioner Roberto Maldonado, who voted against the budget, said he thought the county did not fully consider the long-term consequences of the cuts.
I think that the proposed budget by President Stroger clearly tells you where are they, or where are they with respect to their vision about healthcare. I mean, they're just dealing with the moment. They did not incorporate any elements in their proposed budget looking down the road or looking at the overall or big picture about public health.
But whatever the eventual costs, one thing is clear. At least 1/3 of the county's clinics, many of them located in poor neighborhoods in the south side of Chicago, will soon have to close their doors forever. On a brisk January